Today we got the opportunity to spend the day with the Levittown Fairless Hills Rescue Squad. We got a tour of the ambulance, got to speak with staff members, and also see how they respond to a 911 emergency call. We're talking with Chief Christopher Reef. He's going to explain to us a little bit about the station, the crew members, and what it is that they do here.
Hi, our organization is made up of career and volunteer members that staff paramedic ambulances that provide service to Bristol Township, half of Bristol Township, Falls Township, Tullytown Borough via 911. Our crews are made up of a paramedic and EMT at a minimum, and then supportive staff as well. The station here houses 3 ambulances. 2 are staffed during the day at all times, and 1 is staffed at night at all times. And then we have a substation in Falls Township that is staffed 24 hours a day by 1 paramedic unit. Down here is the bay with our trucks, and upstairs is living quarters with kitchen and bunk room and lounging area.
Can you explain to us the relationship with fire and police and how you guys coordinate in times of an emergency, especially during maybe major disasters such as the storm that we just recently experienced?
We have a great relationship with the local fire departments and the local police departments. We regularly train with both departments in public safety. In times of disaster or emergency, on the scale of the recent storm, we pre-plan with the fire departments and the police departments through the emergency management coordinators of the respective townships. In regards to this recent storm, we met with Bristol Township officials as well as Falls Township officials several days before, and then the day before, just to pre-plan, make sure we're all on the same page.
Can you talk to us about prior to the storm, you had the preparations? Was it what you expected to happen, or did it exceed your expectations in terms of the preparation and what you guys experienced, or did it kind of just kind of fizzle out as many people would have say it appeared to be?
I wouldn't call it fizzle out. I think had we not prepared as well as we did with the leadership of the respective townships emergency management coordinators, we could have gotten ourselves in trouble. The flooding is still hitting us in local areas. The winds are starting to pick up again, and residents are still without power. And this is the event of a disaster like this isn't to a day or 12 or 24-hour period. It's going to affect us over the next 48, 72 hours as well, where we have to be diligent in maintaining public safety.
Can you talk to us a little bit about the storm and what type of calls you were receiving and how you handled those during the peak hours?
We had a lot of calls basically to assist some homeowners and stuff with help with their oxygen machines due to their lack of power and the residents. Also, we had a few cars that became stranded in some floodwaters that we were there just to assist fire if they needed medical assistance.
So would you say that it was a typically busy night for you guys, or was it normal? Or how would you say that it was in terms of your regular coverage?
I believe it was somewhat of a normal night. There were a few calls that were obviously out of the ordinary than our normal routine and calls that we get, but at the same time, it wasn't busier than it normally is.
And talking a little bit about the roads and the driving, how has your experience been during this storm and throughout the aftermath of the storm?
We find a lot of road closures due to water and trees down, so it makes our response sometimes a little bit slower, but we try to keep ahead of it by putting a list on our board of the road closures, notify the crews ahead of time so they can make the adjustments prior to responding to the call.
And talk to us about how long you've been with this squad and what maybe is your favorite thing about the job that you do from day to day.
I've been here almost 7 years now. I like the people that I work with. I like the job that I do. It's nice to help people. You build kind of a brotherhood with the people you work with, and it's just a real tight-knit group, and it's a good job to do. It's I guess you want to say fulfilling.
Today we got the opportunity to ride along with you in one of the larger ambulances, and you were kind enough to kind of give us a tour. Can you tell us about the truck that we rode in today?
Sure. I can take you around the truck if you like, or this is a paramedic unit. We have 5 paramedic units here at Levittown Fairless Hills. They can be manned for an ALS unit or a BLS unit. It depends on the staffing on the ambulance itself.
Assistant Chief Wilson is going to show us around the ambulance that we drove in today for a call that we responded to. Kind of weird. So we're in the inside of the ambulance. Can you explain to me what all you have in this ambulance and how you use it to treat your patients?
Sure. Up here we have what we call oxygen adjuncts. We give these to patients experiencing shortness of breath or difficulty breathing. We supplement their normal oxygen intake.
Pull one of those out and just show people what they look like.
Okay, this is a nasal cannula and a non-rebreather. Both of them are used to give supplemental oxygen to patients. Depending on the severity of the patient's shortness of breath, depends on which item they get.
And moving along, I see we have a gauze and other items in this next cabinet here.
Yes, we call this cabinet basically a BLS cabinet. What's in here is a lot of your normal first aid stuff, 2x2 gauze, some bandages, some cling, some tape, basically for bandaging wounds, and some hot and cold packs.
What do we have down here?
What we have here is a cardiac monitor. It's also a defibrillator. What this allows us to do, it allows us to put electrodes on the patient's heart, and we can see their heartbeat and interpret if there's a problem with the electrical portion of the patient's heart. If we have to deliver a shock, you're able to do so by selecting the amount of electricity and delivering the shock.
Obviously, in the middle of the ambulance, we have a stretcher. Can you talk to us about what the bag is on top of the stretcher and how many patients you can fit in this ambulance?
Okay, the bag on the stretcher is our first in bag. We use this, we take this into the house with us on the stretcher just like this, so we're ready to go with the cardiac monitor also. A couple things I can show you about the bag. This is our intravenous kit. It allows us to start IVs inside the household. Should we have to give medications right away in the household prior to bringing the patient out to the ambulance. A couple other things that I'd like to show you. And this is our IV kit, as I was explaining to you. And something else that we have here, if we're unable to gain intravenous access on a patient, we have a intraosseous drill. What this allows us to do is to attach a needle to it, and we can drill into the plane of the tibia or into the humeral head, and it goes directly into the bone. Therefore, it allows us to deliver fluids and medications to the patient.
What would you use that on a patient? Would that be someone experience
cardiac arrest? When you don't have good IV access, it's most common that we use it on a cardiac arrest to be able to deliver medications to the patient.
This bag goes in the home with the
Yes.
patient. Okay.
This bag goes in the home. Take the bag, the stretcher, and a cardiac monitor, and also we have supplemental oxygen on the back of our bed. Then we take all that in the house. This way we can do and start just about anything in the household prior to coming out to the ambulance and transporting the patient to the hospital.
Talk to me about what the other compartments are you have in the ambulance and how those help you to do your job.
Okay, in the compartment up top there to our left is supplemental fluids that we help use to deliver medications, IV sets. Also down lower we have spinal immobilization. You see most commonly car accidents, falls, where you have to immobilize somebody's neck and also stabilize their head on a long spine board in order to keep their spine in perfect alignment, transporting them to the hospital.
Also behind us we also have some other compartments. What are these housing? And what are the cabinets that are above us? What do they house?
Above us here we have some basic splinting materials. We have a SAM splint. We have some padded board splints. Also, there's some pediatric oxygen adjuncts, and we have some infection control that we use to protect the crew in case of body fluids. So it isolates the crew so we don't get it on us and protects us from infection or spreading disease.
And I think we are missing what was behind you.
What we have here in this cabinet is a bag valve mask. We use that to assist somebody in breathing or breathe for them in such as somebody who's severe shortness of breath or somebody who's in respiratory arrest. In here we keep our drugs, medications for different types of sicknesses, illnesses, and also narcotics for treating cardiac events and pain.
We'll blank out faces. Yeah, kind of color balance a little bit off.
going up, okay, Rick? Kevin, can you go in the bag and get me out a blood pressure cuff? And that stethoscope that is behind. Right, Russell?
Kevin, grab the Addison box out of the bag. Ray, that nitro might give you a headache, all right? Feel a little bit lightheaded?
All right, try to hold still for me, okay?
All right, you can stop. Yep.
Today we got the opportunity to see what happens when seconds really count. Reporting with Levittown Patch, I'm Salika Khan.